Welcome everyone to Access Office Hours. We have a special session today. We have our CanPath Access Office team, but we also have the HDRN Canada Dash team on the call to talk about using multi-regional data to enrich your research. That's what we're here for today. We have a very brief presentation to start to cover the bases. We received just a couple questions beforehand, so we may be able to answer some of those common questions in this presentation, but we will have lots of time at the end to have just an open dialogue with all of you. So to start, we have a land acknowledgement. We acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the CanPath National Coordinating Centre at the University of Toronto now stands. The territory was subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. CanPath teams work across Canada from coast to coast, and so we acknowledge the ancestral territories that are home to many Indigenous people from across Turtle Island, and we are very grateful to have the opportunity to work on this land. Okay, so for today's Access Office Hours, we're starting with a brief presentation from Joanna Wu, the Dash coordinator, going over HDRN Canada's Dash process. And then we have our CanPath Access Officer Noir presenting about our access process. Trina will follow that, our biosamples coordinator, with a brief presentation about biosamples. And then Shiraz will present. Shiraz is our data manager. So let's get started with Joanna's presentation, and then we'll flow through the rest of this outline over the next few minutes and then open things up for questions from you. If you don't want to forget your question partway through the presentation, feel free to drop it in the chat and we'll just save it for when the presentations are done. But once those presentations are done, feel free to use the raise hand function for your questions. Other than that, just one other thing, if you want to pop in the chat your name, where you're calling in from, your role, your institution, to use this as a bit of a networking opportunity as well, we are completely open to that. So without further ado, let's get started with the HDRN presentation. Go ahead, Joanna.
Great. Thank you, Megan, and welcome everyone. My name is Joanna, and I'm a coordinator with Health Data Research Network Canada's Data Access Support Hub. I'm excited to be part of today's Access Hours session with members from CanPath, and I'm here to share some information about HDRN Canada and services of Dash and answer any questions you may have to the best of my abilities. So HDRN Canada is a distributed pan-Canadian network of people and member organizations across the country working together to help Canada derive more and more equitable public health or public benefits from data. HDRN Canada is also the home of the Data Access Support Hub, a one-stop data access service for researchers looking to access multi-regional health and health-related administrative data in Canada. So Dash provides a central coordination point for researchers who want to conduct multi-regional research. It includes a team of representatives from 13 data centers across Canada, and the data centers work together to support researchers in accessing health administrative and other data for research purposes. So these include provincial and territorial data centers such as Alberta Spore Support Unit, ICS in Ontario, as well as pan-Canadian organizations such as the Canadian Institute for Health Information and Statistics Canada. Dash helps with the facilitation and coordination between research teams and data centers to make the data access journey easier and more efficient. And the data are available and accessible through the data centers and are subject to region-specific legislations and policy when it comes to data access and release. Next slide. So on this slide, you can see a more comprehensive list of member organizations that make up HDRN Canada Network. Once again, we have representatives from most provinces and territories, as well as pan-Canadian organizations. Next slide. Since the launch of Dash in 2020, we have developed and streamlined processes to provide support and coordination for researchers accessing multi-regional data. We have also developed resources and tools to support researchers on their data discovery journey. And over time, we hope these solutions will help further automate the data request process and make it easier and more efficient for researchers to access multi-regional data. In summary, Dash simplifies the data access process by providing navigational support and coordination throughout the data access request process process for researchers accessing multi-regional data, offer centralized resources and tools to researchers, harmonize aspects of data access processes across data centers where possible. And we're also looking to integrate technical solutions to streamline and progressively automate the data request process as well. Next slide. As mentioned, Dash Services was launched in early 2020, and we've since received over 182 general inquiries, completed over 156 project feasibility reports. Currently, we have about 28 active projects ongoing, which are in various phases of a data request journey. Last count, we have approximately 574 data holdings available for access through Dash. Dash's data centers, and we've also identified 185 published algorithms validated or tested for feasibility for implementation in 2 or more Canadian provinces and territories or nationally for measures of population health, health services, and determinants of health. Next slide. So Dash can help facilitate access to a wide range of data across our data centers, including administrative data like hospital discharges, emergency room, emergency department visits, physician billings, drug claims, clinical data, including data from electronic medical records, social data, for example, education, immigration, and new data sources are being updated on a regular basis. HDRN Canada is also working closely with data centers to support new data acquisition plans. For example, we have partnered with groups such as the Canadian Partnership for Tomorrow's Health, CanPath, to bring these cohort data into the provincial data centers to make linkages to these data sets easier. There's also opportunities for researchers to bring in their own data into our data centers on a per project basis for linkage to administrative data to help answer health equity questions or any important research questions, provided that appropriate consents and agreements are in place. For more complete information on data available through Dash, we invite you to explore our data assets inventory on our website. Next slide. So as mentioned, we have been working closely with our CanPath partner, and this table here shows the availability of CanPath data across our HDRN Canada regions for linkage at this time. So in BC, Alberta, Ontario, New Brunswick, and Nova Scotia, we have established processes and agreements in place. So this data is available for request in these regions. PEI Newfoundland, we are working on formalizing our process and data sharing agreements with these provinces. And in Saskatchewan, Manitoba, recruitment is in progress with CanPath still. So once recruitment's completed, we can kind of move on to establish those processes and agreements so that our data centers can have more readily access to this cohort. Through our pan-Canadian centers, CAI and StatCan, linkage to CanPath data are assessed on a per project basis at this time. As well, linking CanPath data is not directly available through our data center in Quebec, which is the Institut de la Statistique du Québec, but it may be available through through another organization. So we do encourage researchers to get in touch with Cartesian if they're interested in linking administrative data to this cohort at this time. Next slide. So this diagram here outlines at a high level the main steps involved in the Dash data request process. If a researcher or anyone has a project in mind, we do ask that they first create an account online on our Dash website and submit an intake form. Once we receive your intake form, which includes high-level information about your project, we can coordinate an intake meeting with our data center representatives from the provinces and territories of interest and our pan-Canadian centers. And this is typically coordinated within 5 business days, depending on the requester's availability. We will review your request and determine eligibility, feasibility, and estimated costs for a project. And this assessment is returned within a 2 to 4 week period following submission of an intake form and meeting with representatives. So all this falls under activities within phase 1 of the diagram, and it is free of charge. It allows us to connect researchers with our provincial data center representatives for an early opportunity to ask questions about their project and share feedback. And with this feedback, researchers may be able to take this information to kind kind of further develop their grant or apply for a grant application. So once a research team has reviewed this information, confirmed that they want to move forward with a request and have funding in place, we can proceed to a formal data access request. And this brings us to phase 2, where we will work with you to coordinate the local requirements and appropriate documentation and approvals needed to move your request forward. Just want to mention as well that some of our data centers do offer analytical service support where it's available and if needed by research teams. And in phase 3, upon completion of your project, you'll be able to access data in a given secure environment, and you will be invoiced accordingly by data centers as many operate on a cost recovery basis. Next slide. DASH has also developed resources that can assist researchers in the initial development of their project. So we do have a data asset inventory. It's a repository of data assets available at our member organizations that can be requested for research projects. It allows you to search by region and our sites, data categories, keywords. And this is a great resource to get a sense of data available, the data that's available when you're developing your project. We also have an algorithm inventory, which is another resource on our website, which includes information from systematic reviews to identify published algorithms for measures of population health, health service use, and determinants of health. The Pan-Canadian privacy legislation tool on our website includes information on the availability of specific types of information about health data and its usage with regards to privacy legislation, advice on disclosure of personal health information and de-identified data, and informed consent wording for administrative data linkage. There's also information on our website about local data access processes and specific requirements and services offered. For example, if a data center offers remote access to the secure environment and whatnot. And we strongly encourage researchers to explore the resources available on our website if you have not already done so. All the resources listed here are available publicly on our website to support researchers in early phases of project development. And once the researchers have decided to move forward with DASH, they will have access to additional sets of tools through our DASH portal as well. Next slide. Should you have any questions about DASH or need any support in completing an intake form, please do not hesitate to get in touch with us. We can be reached at dash@hdrn.ca. And next, I guess I'll turn it over to Noor for an overview of CanPath's access process. Thank you.
Great. Thank you, Joanna. Hi, everyone. My name is Noor. I'm the Access Officer here at CanPath, and I'm just going to provide a quick overview of the CanPath access process. Next slide, please. Just a brief introduction. CanPath is a population health research platform for assessing the effect of genetics, behavior, health history, and the environment on chronic diseases. CanPath follows the health of 330,000 adult Canadians. CanPath is a platform that includes questionnaire data, biological samples, genomic data, physical measures data, and also data linkage. As Joanna has just described, we work closely with our colleagues at HDRN to allow you to link the self-reported data to administrative data. Also, CanPath has a long-term follow-up, so we do have our baseline questionnaire and follow-up questionnaires as well, and some of our regional cohorts are already out in the field collecting new data as we speak. Next slide, please. So in this diagram, you do see our 7 cohorts across 10 provinces in this diagram. Going on next slide, please. One of the most important questions that we always get is you want to know how you can access CanPath data and biosamples. One of the requirements is filling in an access application form, which is available on our access portal. So we'll also drop a link to that in the chat later, but that's where you would start. Next, please, and also providing a research protocol that has received research ethics approval and, of course, an approval letter from a research ethics board. And also, we require a 2-page CV for the principal applicant for the application. If the project has been reviewed, like peer review, we would ask you to provide that as well. And finally, we also ask for evidence of funding if applicable. So the evidence of funding is not required for all projects, but larger projects that do include linkage or access to larger amounts of data or biosamples will be asked to provide some evidence of funding. And then the next point is the contact information for your legal institutional representative. So this is going to come up in the access application form itself. The way access to CanPath data works is that once you have filled in the access application and submitted it, and it goes through our various reviews, there will be an agreement between your institution and CanPath represented by the University of Toronto. And that's why we ask for the contact information on that access application form. Next slide, please. So one other question we always get is how quickly can you access CanPath data or biosamples? So we do have two types of reviews. One is expedited and one is full review. When a researcher asks to access harmonized data, this is flagged for an expedited review. We do try to move it quickly as possible, but it would range between 8 to 12 weeks. And if the application includes access to biosamples or there is regional data involved, or there's linkage to administrative data or cancer registries, then the application will go through a full review. The timeline for full reviews can vary depending on the scope of the project. Next slide, please. When we talk about expedited, we are referring to access to our harmonized data sets. Harmonized data sets include those listed here, and my colleague Shiraz will go into more detail about our data sets, but this is just a brief overview of the data sets that are harmonized and flagged for expedited review. Next slide, please. And this is also a slide going through applications that require full access review. So if you are going to request biosamples, or if you're going to link your project. So if you're going to collect, access data from CanPath, which is self-reported questionnaire data, and then link it through administrative health data, just as Joanna was describing, we would work closely with our colleagues at HDRN, and that would be an application that would be flagged for a full review. And finally, if you have any regional data, so that's the next point, that would also be flagged for a full review. Okay, next, please. We also get a lot of questions about the cost. We do have our cost recovery fees posted on our website, but I do want to add here that these are for applications for academic researchers who are interested in accessing the data only. If you're interested in accessing biosamples or your application is going to come from an industry, for industry-based research, we do ask that you reach out to us at apply@canpath.ca or at access to provide you with a customized cost estimate for your project. Next, please. Yeah. That table is from our website as well. So, yep, yeah, that one. All right, so I'm just going to go through a few frequently asked questions before I turn it over to Trina. The first one is, before applying, can you get sample sizes or estimates for your project? The answer is yes. My colleague Shiraz and Trina and I would work with you to provide some sort of preliminary aggregate data for your project. So feel free to reach out to us if you require that before submitting an access application. Another question we also get is, can you get a cost estimate or a letter of support? Yes, we ask that you complete the form, which is available on our CanPath portal. It's a request for a letter of support or cost estimate. We do ask that you get in touch with us as early as possible. Our turnaround times is usually between 10 to 15 business days, but if your project includes requests for regional data or biosamples, this may require more time. So we do ask that you reach out to us earlier. And then finally, what are the estimated timelines? So for expedited reviews, it can be completed within 12 weeks to access the data. That does not include the time, I would say, to execute the agreements. This is just for accessing the data and conducting the access process, which is the different levels of reviews. The timelines for executing agreements vary between different institutions. Applications that require full review, the timelines can vary, so it really depends on the scope of the project. Next slide, please. With that, I'm going to turn it over to my colleague, Trina. Yep.
Thank you, Nuar. Next slide. Okay, so as Nuar mentioned, CanPath is made up of multiple regional cohorts, and we have collected a wide variety of biosamples that are available for request. This includes many blood derivatives like serum, plasma. We've also have urine on a large number of participants, and we have some unique samples. Our Atlantic Path cohort has toenails in their collection. And when we weren't able to acquire a blood sample from a participant, we did try to obtain a saliva sample from which DNA was extracted. Next slide. So as we all can appreciate, biosamples are a finite resource, and for that reason, we have developed 2 documents to help guide you with your access application. They include our access guidelines, so those criteria that we will be looking for, and then our biosample feasibility review. So what does that look like when you actually submit that request? So these 2 documents are available publicly on our portal, and I encourage you to take a read of them if you are interested in biosamples. Just a note that if you are seeking biosamples, large volumes of non-DNA samples, so that being greater than 0.5 ml or DNA greater than 2 micrograms, we consider those a large ask, and therefore you be prepared to provide additional scientific justification for those amounts. As Nuar mentioned, you will require a full access review. And of course, if you are successful and receive an approved project, we do reserve the right to release the biosamples in a staggered format. Next slide. Okay, so when you're filling out that application, what are some key points? Number 1, make sure there is alignment. So if you are asking for a particular biosample type, ensure that it is consistent within your application and that within your protocol. Second of all, in terms of numbers, if for some reason the number of samples you seek differs from the total participant number for the study, just provide an explanation. Third, do take note of the units when you're making your biosample request. Liquid samples like plasma and serum will be in microliters or volume, and DNA is in mass, so micrograms. There's also, we will be asking questions about tests and number of tests and number of biomarkers. Just for clarity, tests are number of assays, where biomarkers are the number of markers you're actually measuring. So an example might be you have 1 test or assay that looks at 96 markers. You may choose to use a service provider, and that's perfectly fine. Just make sure you provide their details. And if that service provider has information on how to submit samples or volume of samples, please include that within your access application. It can be added as an attachment. And finally, just a reminder that when you have performed the analysis on the biosamples, you will be required to return both the raw and the analyzed data back to CanPath. And now over to Shiraz.
Thank you so much, Trina. So I'll just quickly talk about, as my colleague Noir mentioned, about the CanPath data, because I'm sure everybody here probably has a glimpse of what it is. But yeah, next slide, please. So this is just a quick picture of what CanPath's harmonized data sets can hold. So we have our core data, which are the harmonized baseline follow-ups, and including some COVID and serology data sets that were listed in the previous slide. They include up to 4,000 variables or data elements, and all sorts of information, including lifestyle information, medication information, healthcare utilization. So that's been captured thanks to our partners, pan-Canadian partners in our regions across Canada. We also have our collaboration with Canoe, which is where we receive most of our merged environmental exposures data. And then we do have two other sets of data, which is our genotyping data. We have a pilot set of participants that we've conducted this pilot genotyping on, which is about 5,000 nationally. However, you'll see in this section that we actually have more than that. We have about upwards of 50,000 participant genotyping data across the regions as well. So that's something that's quite valuable, and a lot of researchers look for that. So please definitely take a look at the genotyping data that's on hand. And then with our partnership with CAHHM, which is the Canadian Alliance for Healthy Hearts and Minds, we also have what we call deep, data into the cardiovascular space as well. And this could be very deep measures, like we have MRI images for some individuals, which is thoracic and head images, as well as cognitive measures too. So definitely something for anyone interested in those research areas. So just a quick glimpse there. Next slide, please. And when it comes to our harmonized data set, we really emphasize the core because that's the one that has been harmonized across the regions for all structured variables. And it includes follow-up. So we have our baseline, which was conducted between 2008 all the way, actually all the way up till 2018, I think 2016. And then we have our follow-up, which was done from 2016 on to 2019. We have our COVID 2020 questionnaire that we did, and as well as our serology or antibody study phases as well. We also included in here the genotyping data because while it is considered a separate non-harmonized, it is within the realm of data-only applications. And so there is the opportunity to get that expedited as well. However, if you are going for the 50K, as I mentioned, like the larger, that would be a regional ask, and then we will try to process that as soon as possible. But that would be a full review for that sort of data as well. So yeah, just a glimpse of all the different types of information. We have health, lifestyle, mental health, physical measures, just to give you an idea. But really, I would encourage everyone, if you have a chance, to go to our data portal online and just navigate and see what's available through CanPath and our harmonized data sets as well. Next slide. And so just like Trina, I will share a few quick tips when it comes to considering when you're doing your Access application, what aspects to think in terms of the data. Well, firstly, in terms of the participants, are you defining them based on a certain criteria? Is that criteria met within the CanPath core, or perhaps within just the CanPath dataset, or does it require, as our colleagues here in HDRN are here, would it require you to consult with them and see whether or not the eligibility criteria may have to venture into those? So definitely something to consider. How are you defining your participants so that there's a clear idea of, we can then go further and talk about sample size then. And then, yeah, that's the next one, number of participants. So once you have a very clear understanding of what kind of target population or sample population you're looking at, well, then we try to have a very specific number or count. And so in the application, we often say, we wouldn't want any general terms saying all of such individuals. We like you to, consult with us and try to get an estimate. And we are happy to do that. We often provide preliminary aggregated numbers and counts, and even letter of support. So please do get in touch with us if there's an area that you're maybe unfamiliar with, or you haven't found any CanPath publications previously noted. So you can come get in touch with us, and we'll be happy to specify as much as possible to get you a sample size. And the next, selection criteria. This actually turns out to be very important because oftentimes we have some things missing from the inclusion and exclusion criteria. Oftentimes you think, oh, it's just age, or if it's just a sociodemographic aspect. Well, yes, but also oftentimes we can ask you whether or not some criteria is optional or good to have, and whether or not you have a core set of inclusion criteria. So that way you could actually create a more expansive and inclusive study model rather than a very exclusive study model, which will limit your sample size consequentially. So yeah, and that's very important. Yeah, case control. If you are doing a case control study, definitely good to consult with us and our folks at HDRN and the regional custodians to see if whether or not you'll have a good control group as well to match with. Oftentimes we see that the criteria is very general in the beginning, and then as further along, we find various factors or components that make it difficult if the case controls isn't defined very well. And so we definitely encourage, if you have something in mind, consult with us and we can definitely make it easy for you to, specify your case control modeling. Yeah. And yes, the variables. And now I mentioned the data portal. It'll be very helpful. So one of the features of the portal system that we have online is that as you're doing your application, you can actually use the data portal and select the variables of interest for your application, and then just include it within your application. And it definitely helps us because it allows us to do the selection based on that set of variables, and also really ensure that you get everything. So it is comprehensive then. And the last point, I think there's one more, data linkage. And that's the main thing we're here all for, because our folks in HDRN are the resource that we sort of lean on when we do all things data linkage. Just to keep in mind, data linkages of any sort, we often go for a full review. So it's always good to allow yourself some time when you're thinking of data linkage and to really gather as much information so that you do receive enough information from our regions, from the CanPath folks as well, when you are planning and creating your proposals.